Hello, my name is Moye and I am a certified addiction recovery coach. Quickly, I'm going to be talking to us about addiction recovery, why are we trying, and the major intervention for addiction recovery. So, first of all, why? Addiction recovery, unlike other illnesses that you take medication, say malaria for instance, and then you take your medication and then the malaria is gone. But for addiction recovery, it is not so, because it is a disease of the brain, and we know that the brain never forgets. Even as an adult now, I can still remember some of my childhood memories. That's how it sticks in the brain, and that's why a lot of people, even when you have gone through recovery, you can still be triggered and then there's relapse. So just even knowing that it is a major or a chronic relapsing disease, it's good to know, so you know how to go through the recovery process. Okay, so the aim of treatment is to improve the health and quality of life of those suffering from drug addiction. Okay, so treatment is necessary. It is important for you to know that it is a fight that you will keep going on with for maybe the rest of your life, or a couple of years, depending on how disciplined you are with your recovery process. Now, we're going to talk about major intervention therapy for addiction recovery. Number one is counseling. Just understanding, okay, this is where I'm at. These are the dangers, this is what I'm losing and all of that. For some people that haven't gone so deep into the substance abuse, it is really easy for them to just wake up one morning and say, I'm not doing this thing again, and it works. Really, there are some people who can be that disciplined, but we are not going to rule out the fact that for other people, they are deep down in it, and even if they want to, the things the things I want to do, I find myself not doing them. I do the things I do not want to do. Apples to Paul, so even when they say, I don't want to do this anymore, it has gone beyond their willpower. The craving is still there and all of that. Then there's to get detoxified, and I think something I should say, detoxification is not for you to go and take 100 drip to flush your system. It is not. The moment you stop taking this substance, your body just begins to detoxify on its own. You get so for some people it takes 2 weeks, others 3 weeks. It depends on the individual and the substance that you have been using. Okay, and then there's abstinence. Abstinence can be outpatient, or it can be residential. I usually advise residential because it gives you the space, or put you in an environment where you can actually say no. You get, so for some people, for outpatients, you're in, you're out, you're in, you're out, and then you're in the ward. So it's for example, alcohol. They're still doing it all around you, and you're trying to stay off. But it's easier when you go for rehabilitation. Being in a rehab gives you the necessary knowledge for you to go through recovery. Like your cravings management, for example, you get to understand that, you get to learn the 5 Ds, which is delay, distraction, discuss with a friend, deep breath, and drink water. In another episode, I'll break down and talk to us about what cravings management is about. But yes, so that's what we have do for you. There's also the mutual help and support group, which I should say I'm starting a support group for people who are going through recovery. I'll put up the flyer. Mutual help and support groups, it's you surrounding yourself with people who know what you are going through, who know your goal for recovery, and who are helping you achieve the goal. And lastly, there is drug substitution program, which we have not started doing in Nigeria yet. For opioid, for example, there are some opioids you are addicted to, so they stop you from that particular opioid that is so harmful, and then start to substitute it with another drug that is not as harmful as the one you are in. I think in another episode, I'm going to talk about drug substitution programs and why I think we should do it in Nigeria. So yes, I hope now you have the understanding of the various intervention therapy. So if you have a loved one or a friend who is currently fighting with drug addiction or substance abuse, please reach out to me, and I would really love to be of help. I hope that you have been educated. See you in my next episode. Bye.